I went to a medical school today and talked to them about a life in direct primary care, and they had so many questions that I thought I might share some of those with you. My name is Jay Vintage. I'm a board certified family medicine physician in Oklahoma City. I own and operate a direct primary care clinic, and I like to show medical students, residents, and attending physicians a side of medicine that may not be shown very often to them while they're going through training. So there's a couple things that I bring up. Number one, what a direct primary care is. Number two, the way the normal system sort of works and how they differ. And number three, what my life has sort of been since I've opened and operated my own direct primary care. I then try to just get them to be asking these questions early on in their career. So they have some sort of an idea when they're going through rotations or they're comparing this story against their lived experience, whether they're an attending or a resident or other. So a couple of the questions that I got asked. Number one, how many patients do you need to make it work? And of course, that's going to depend on expenses and how much it takes to operate a clinic. But the cool thing about direct primary care is I do not need to hire an army of people to argue with your insurance company. I actually just hire who I need. There's a lot of micro practices out there that are ran by one physician in a single room clinic that has minimal things, which means minimal expenses, minimal overhead. I mean, realistically, let's say that you spent $1,000 a month to rent a room somewhere, and you actually had 250 patients that you were able to manage out of that room. Well, you do the math. If you have 250 patients paying $100 a month, then you're actually looking at someone that's making $250,000 a year, less expenses like the EMR, any of the lab costs and things like that. And you can make a really nice living out of a single room without having all these people between you and your patients. Now, of course, different clinics are going to have different expenses. For example, my clinic's like 1,200 square feet, or there's other clinics that are 3,000 square feet. There's many people that have multiple employees, but the math is actually a lot more simple in direct primary care than it is in primary care. Also, there are other questions like what types of patients do you get? Can specialists do this? Should I start after I've gotten some real world experience for a handful of years, or should I start right outside of residency? And the point that I'm trying to make here is it's very wonderful to go to a med school, be able to talk to a group of students, whether they want to go into primary care fields or not, and just have them learn that there is a different way to deliver medicine, and there is a way to do it without the insurance companies meddling and how they get paid, and ultimately how they take care of their patients the way that the patients deserve to be taken care of.